Kiinam kaimutikab borto en Jane Barngetuny en kenyitab 1997 ak en 1999 ko kisich kaimutikab tikitikab borto.
Kokiname borto kenyitab 1997. Koimatau ang'ung'u. Ang'ung'u kotatun koit ang'ung korotik. Kianyatege kabisa awendi Nandilis kikwenya uni kikikwenya nekit ang'wan eng Nandilis. As kotoi kinya komakas. Anyage 2000 ko kimi chumbindet nekikure Dr. White. Kotoi pikchaishekyik Dr. White. Salen koker ko kikonon akutania. Bune beek chenyolilen amu kiang'ung'u kityo kimatakomi ki age noe. Ki nesisei ko beek lakini ki baadaye ang'ung'u. Ko mutai ketoreto akutania. Atebet en 1 week. Nebo aeng anyo gaa. Nyokaitu gaa. Nyokomnyeit nyatestai kokararanit. Kenyit nebo somok konama kit age kokeny. Nikiaima olikiae chapuk. Akosumbuana kabisa nikiawache kityo. Kilabaten akoi Tenwek. Ait Tenwek ipkeker kele hapana operation. Anya nyungakaiwo atar wikit kora. Anyo gaa. Saketebi as ketebi kabisa wo ketebi kenyisiek nekit 7 anan 6. Koit korot kityo kunoto. Akoirio suet. Kekanabata namo murenik ang'wanu amu mame kot kotwake. Ngot kotwake kotos abeku kabisa. Akoi tun anyo Eldoret Hospital. Aib kerichek makas. Ipkiwecha kora. Auni konyeta. Ipkiwecha kora. Ipkiaya mara eng metit. Kiwekwo nyokoro. Kulecho kikoibenin bendo nyu. Atya kochilin nerves. Kikinya makas. Makas kabisa. Kengetosi karon kebwone akoi koech. Nyikitu koech kele kakomanda. Kele kakwo Nairobi. Awakate kunoto awe gaa. Ipawach koech mutai kindo karit kora. Kebwone. Ngechunu kele uruno kabisa katona. Kawo kolany ndegeit. Arir ma. Kiaririre chetom chetarire kora. Betut nerube konyo chito age nekelel yut. Nyokolong kecham kora. Kebwone akoi Eldoret Hospital nyekenyoru koech. Kolechu ko nerves chiking'ema kabisa tayari. Kiekui. Kong'ololwo daktari akokon advice nebo kwang'ut. Kotko nganyone kakoisisit en metit nekiakokok.
E wikisiek aeng chekisub ko kiimuch Jane kwendot.
Abwoti daktari koech kabisa kosusei kisus kalamit akokero. Akochol kolecho karibu nekit botebu kolecho Jane. Kolecho karibu kabisa, karibu ma'am. Karibu kabisa. Alechi asante daktari. Kolecho karibu mang'et kolen karibu kimwa akoi. Ibole yon daktari ini kae. Atebu ng'weny koketyo kerichek kosirwa. Ipalugui. Nganyone nebo aeng anyone kityo. Memutwo chi wikisiek ata kora. Aeng. Memutwo chi. Akipotabotebi gaa. Manakiribanye kityo amu maname tugun chenyikisen lakini tuguk auni amwachokani alechini lagok koba mesa konyi mesa boun.
Kanda kisop Jane ko kiit kasarta nekisich kaimutikab konyek. Kit nemanai konyoik kole ne.
Kolen ipkotyem daktari kole koro konyek kole mami ki. Kokona kerichek kolecho sikoun. Mami ki nekiwala. Kimuta Tenwek. Ipkopiman chumbindet. Ipkolecho Jane. Kolecho mataelewa lakini ameche atyem namuche anya. Kokona kerichek as chekirongyin konyek akona chekilugui. Ko ngawendi as nebo lo, yani nebo wikishek lo, ko kakerte lakini ya konda agenge. Ibamwachi chumbindet alechi koibwa testi kolecho makoya, alechi lakini makerto as nebin right. Kolecho imuch konyo mutyo. Nyikakitu kaima. Nyokowekyage konyek akome komasi kole akome eut kobisis inyen mamino kilen mokoken kole kakoisis akot ngolen nanamki kole maname akotoi kele nguno koek quick.
Kiwekyigei Dr. Koech ne kiimuch kotoret inendet.
Kolecho nabis kinginyachi kibo suket kokonopkei kobwa ole metit oli. Arori tatya alecho asobe man. Kolecho isobe anyoi. Alechin konyek kolecho achengun chito neinyoi konyek. Lakini baadaye kong'et nini inyoi konyek lakini baadaye ibor solis nyakonin kerichek chechuk chebo nabis. Ko kityem konya mam Koech chebo kerto. Inyo nimbo konyek nekile Dr. Bett, konyo nebo konyek akonyo Koech, konyo nebo konyek konyo Koech. Ipotoi akerto kouni. Ak nyito alen anyun takertoi koit kit age as konama moet akokasana kolecho akolale kot komarue. Alechi Koech asin kakong'et nini. Alechi Koech mi kit nekakolal ing korosoik. Kokona kerichek komakas. Tun nyokosokyi komakas. Aeng kolecho ameche iwe radio care. Ameche pkicher bendo kiyokto kwa Nairobi asikiro ngot komi cancer.
Kiibor testi kole mamite seriat akosubkei ak noton ko kiimuch Jane konam kerichek. Akot kou noton ko kitesak ng'wonindo nekitinye.
Kochun daktariek nyokokere kobendi. Ngochun age tugul koro CT scan. Kokere soromoik kityo kakolach kakonam tukcho kabisa koekitu kakomach kuti. Amakikere tom kenyor mogonjwet nebo yu. Ako nito nemeche kolya, meche kowar. Kokur Koech Matenge Olo. Konyo Olo. Kolecho ameche kebe endoscopy. Kolecho kit nemi yu ko kit age nekakobiririt akobwa. Nito nemeche kobar ine. Amu kikirutyin chebo ng'wonindo kityo. Mutai kinama akoi theater. Atar beishek ata 4. Betut nebo mut keit karon kele awendi operation. Mwowo kialechi awendi theater ano amu katebusishe kole nemomeche kot ketwa takiwecho. Kolecho amu kokebuken mashinit ko mashinit komandoi matebet agenge ako nitok inegei eng Kenya mzima. Kolecho ko suppose ikilgei. Ko amu uchungunik chatinye ko kiarir koimen. Ako chemarire kiabwone biikab kong ichegei. Ko kibwone biikab kong ichegei kole kobwone konye sitit aname sititab sipitali alechini kole sitakoba alake. Ko kikeimgei metit nganendet amu kesubkei operation. Ako testai konya atubil. Akot nguno kotakotesetai tubil konyo.
Kosubkei ak kanyoindetab tetutik anan psychologist, Dr. Kevin Ruto kobo kamanut counseling eng chi age tugul, mising ko chebune kaimutikab borto kou Jane.
Preparation nebo patients mentally, psychologically, and physically for any operation or for any procedure or for any treatment ko very important. Amune, number 1, nigochi patient information from the beginning. Komuch kokuyo kole ne shida nanyin. Komuch kokuyo kole kanyoisetab shida nenyin kotekeni kasarta netya. Options chebo kanyoisoni chebitunatin ko kichechu ak kichechu ak kichechu. And options. Ak imwoe ngunon outcomes chachik after the surgery and the length of treatment konini. Ko toretin in what way? Number one, toretin ko accepten ke mugonjo ako accepten condition nemi. That acceptance. Number two, ko toreti kora the people around them koguyo mugonjo ne kole shida nanyi kone kokimuche ketoretiten ano. Okay. Number three, ko this patient will be more accepting for the treatment that they are going to undergo. So in case ko medications, for example, after the surgery, in case ko physiotherapy, what we call physical rehabilitative therapy, to be able to get back to their feet and do things, okay, it will become much more easier than more given up so easily. That is number one. So they'll accept that more, medications and all those interventions. That is number one. Number two, that will prevent also ama sinking deeper into what we call mental health, other mental health conditions, such as what? Depression. We have patients who go into depression, especially yame preparing mgonjwa komye. Imwachi le, these are the expectations after this and this. Ko realize ngole, this is not what I wanted. Okay, after this operation, they sink into depression. Once they sink into depression, it is now one problem on top of the other. Now you'll need to manage them again for the depression, okay? Which is at times too hard because come preparing. So that really helps. So it prevents depression after that. Others even go into drug abuse, even having suicidal ideations. Me, nilienda, nikafanyia operation, ama nikatibiwa hivi, lakini I do not see any improvement. So one day, younger me geriche, then they decide to ask one day, you know what, I quit. Anachukua hiyo dawa, anameza yote. Because they were not prepared what? Psychologically that these were the expectations. Lakini ni prepare them in that way, they'll be more receptive, they don't sink into further mental health issues, and their healing becomes even what? Much better. Now, treatment of conditions in our brain, and spine, kuma short term. Magine ne nyoera warong kihisa. Long term, a majority of them going for months to years of follow-up, at times recurrence of the same. Okay? So with that understanding, it even helps the patient, because they can even what? Medications as an individual, kunyur that self-drive. Okay? Like that. They know what needs to be done at what point. So we na majority of them kumutuke hospital nda muninge ngole nene tesetai. Unlike ndagame prepare. You get?
Nite che cham kiyo konyorwo. Kengololi. Kokona counselling. Ngobendi kakimitu. Kongololwo. Kolechino kokona advice tebi kuni. Che. Kolecho kabwatutik komakindo metit. Kale ngikulecho nginde metit kabwatutik. Kale kosire kabwatutik miondo. Kale yai mising kosir miondo. Kocham koneto kabisa nyule. Ngot kotebe metit kabwatutik ak yome kerichek. Kale koiku sumu. Kale ngete amwasit chetumdogei. Kale kongilugui kerichot, kale kowalak koek ne? Koek sumu. Kale makotagonyoi borto eng oret ne kararan kerichechoto. Kale wendi iman ikose kesop lakini wendi ngoit moet kongem. Ane ko kiachop sinyin chekichoti. Ane ko kianyalilda kabisa. Nyalilda kabisa. Ningalen ko tabwat kole ngabawa akot ngami oret abwati batyen. Atau tiendo. Aturur chobatyen ale sikobetyo. Mameche kotabwat.
Kotomo kinya chi age tugul, ko magat eng kanyoindet kokoito counseling akobo kit ne magat keyai.
There are those patients, patients who are born as an emergency. Okay? Who patient now as an emergency, who are patient that you really do not need to prepare them because that is impending danger. That is impending what? Death. An example is a patient in Marago who are involved in an accident. What in a very huge bleeding brain and probably their consciousness level for them to be able to make a decision come possible. At that point in time, we usually keep prioritizing enough. Yes, even go wrong the life. Say that tomorrow now, we can talk with them. But for those other cases, chama emergency, a patient kuko tindo a problem that has been there for a while, for example. So for that a patient, we call them elective. My emergency elective kogine we plan. We number one kagi investigate and then from there we plan. This is a problem. The surgery. Then we give you time. Internalize and what are the outcomes? So we give you those options, then we give you time. Okay? Besides that, we bring what? We have psychologists on board who help us to prepare these patients. Line in the daktari kuka mwago uni damun inginene aginene o outcomes ko gichechu. Okay? Then ko wala ka mo ito karaki kiborchini the patients ni ko uni ako uni lakini muchi ko nyo na ko mo ko muje kwendo ka kwendo ra ko nyo na ko mo ko muje kolia kosoita ra. These are, we have videos, we have recordings, so that really prepares them psychologically anafu inatoa hiyo woga. Okay, so go mwangu so torungu nan ko igu very easy ndamun. By the time now we are taking this patient to theater, go already go they know everything that is in the backyard in theater ongen outcomes. So usually we usually prepare them so well.
Kora, ko magat keng'ololji tupchosiekab chi age tugul nemyoni asikomuch konai ole imuche kotoret inendet.
Goguya condition about these patients. They solve something called what? Stigmatization. Okay. Magiring go chi neme, in case you cannot be able, I'll give an example. For example, a patient who comes in with maybe a bleed or a tumor, you might end up with what we call focal neurological deficits. Focal neurological deficits mean you might a few things. Paralyzed in one hand, even after the surgery. Okay, so you might not be able to do that. Go with the people around you, less will be expected of you. Okay, so people will not be pushing you so hard, expecting you achieving a lot of go with those conditions. Another example, patients get into brain and things like epilepsy, which is a brain and whatever condition. Chronic treatment for long. Once in a while, ulikuwa sawa kabisa, then a convulsive episode. Then it recurs again maybe several months later. Some of our patients who go post-operatively tend to get that, what we call recurrent convulsions, or what would be more of epilepsy. You get touching some part of the brain, which can be triggering convulsions once in a while. Those ones, we usually manage them with medications, at times for life. Okay? Can you imagine a scenario whereby care an operation, kuma kutindo patient in convulsion, you are now post-operatively, like they are getting convulsions. Okay? Preparing these are the possible complications post-operatively, but if you do not prepare them, they can easily give up. Like they prepare and go with us and they take their medications freely, they live their life to the fullest. Okay? So basically, my take-home message one. Preoperative preparation the patient. Okay? Kotoma kwa surgery, koguye. And post-operative, okay? Komuch kotesenta treatment, a follow-up is irreplaceable. It is actually more important than the surgery itself.
Kates Dr. Kevin Gole, po kamanut neo counseling en biik chekimuti theater.
Me gain anything, you rushing into surgery, come prepare a patient, the expectation, you do not achieve much. The outcomes becomes poor. Yeah? They become poor. The over 90-95% good outcomes that I was talking to you about, I would say that we attribute over 75% of that, not to the surgery, but to the psychological preparation of what? This patient. For them to be able to continue with what? Treatment. The rest of the 15% goes to the surgery. Okay. The rest of the 5%, of course, I can tell you, life is not perfect. It's only God who is perfect. Yes.
Topili, hospitali ni saru, nerves, hospitali ni saru, metiti, ni matinye kaimutik. Akot kitigin. Ako kameche amwochi biik kole monotok inegei. Ma nerves ak metit inegei. Chang tuguk cheyoe daktari yu. Che ngomite mogonjwet age, konget ole sarundoi. Akot chi no kilen kikoir nerves mi ng'weny, akot chi no kilen kokomach kolya metit. Ngosom, ngo lagok akot chemengech kochoi chepyosetab koech. Atyeme kora ale kimut topil, amu mi topil ine. Konyoi inendet.